Hello everyone. Today we are going to learn about CPR. So what is CPR? CPR is cardiopulmonary resuscitation. It is something that is done to save someone who has had a sudden cardiac arrest or who has fallen and is not responding in front of you. The first step is to recognize a cardiac arrest. I am going to take you through the steps of cardiac arrest, recognizing it, responding to it, and the steps that those are required for doing so. So for recognizing a cardiac arrest, initially you need to recognize or check if the patient is responding or not. How do we do it? We should gently tap on the shoulders of the patient and ask, are you responding? Are you all right? Are you all right? Are you all right? If the person is not responding, call for help. Anyone nearby you can call for an ambulance. Or if you are alone, you can call for ambulance by yourself. After that, we need to check if the patient is breathing. We need to open the patient's clothes. Probably in a male patient, female patient, we can just go down and check for breathing. For checking the breathing, we need to go to the patient chest level and check if there is rise of the chest. Ideally, we go at the level of patient chest and see if the patient is breathing or not. The steps are, if there is chest rise, if the patient is breathing, you can hear some noise from nose or mouth. And if that is not present, you can assume that patient is having a sudden cardiac arrest. As soon as you recognize that patient is not breathing, you need to check for the patient's pulse. Pulse is something that tells us that the heart is beating or not. The way you do a pulse check is, you have to check for carotid pulse. Carotid pulse is located just next to the windpipe. Windpipe is a pipe that is at the center of our neck. Once you recognize the windpipe, just go 1 centimeter left or right to it and check for pulse. As soon as you recognize the cardiac arrest, start with chest compression. Chest compression is done at the level of nipples in the middle of the chest bone. You place your dominant hand right or left at the patient's chest bone at the level of nipple. Take your other hand, clench your fist and start giving compression. The angle has to be wrist, elbows and shoulder are supposed to be at the same line. And your angle has to be 90 degrees with the patient's chest. After that, you start giving compressions. After giving 30 compressions, you are supposed to give 2 breaths. So each cycle comprises of 30 compressions and 2 breaths. Now this has to be continued for 5 times or 2 minutes roughly. After every 2 minutes, we are supposed to check for the response of the patient. It can be seen if the patient starts breathing, or we can check for pulse again. After COVID, we have learned that giving breaths is not so important. If we are not able to give breath, we are just supposed to continue with chest compressions. Ideally, chest compressions should be continued for 2 minutes, and after that, we have to check for the response again. This we are supposed to continue till the help arrives, till the ambulance arrives, or till a doctor has come and tells you to let them take over. Thank you.